Back pain has ruined more men's dreams than loose women and alcohol. If you battle low back pain, maybe hip pain, knee pain, watch this video and I'll explain to you what happened in it. So what you're seeing here is quaking in my legs. This is a neurological issue. Now these legs are innervated right out of your lumbar spine. Now notice how this stops. It starts again. Then it stops. Let me show you what's going on. Right here in the lower back, in the lumbar spine, that's where the nerve supply is for those lower limbs and the legs. Now, people with back pain have typically gone through a core strengthening regimen, which is just great. There's nothing wrong with that. It's usually quite effective, honestly. But every so often you've got random cases, extreme cases, or just novel cases, different cases, where the inner and outer unit muscle groups of the core are not integrated. They're not firing right. So typically, back rehab protocol is going to work on strengthening these muscles. When you think about strengthening the core, a lot of times we're looking at this rectus abdominis right here. These are the six-pack muscles. And then we'll do some focus on the obliques and some focus on the spinal erectors. And generally there's some glute work in there to go along with it. But what's missing here is the inner unit. Now, for all intents and purposes, if your core is working properly, when you turn on the outer unit, the inner unit should turn on as well. But we don't live in a normal world. We live in a world where we sit a lot, where we're sedentary too often, and we're not doing all the different movement patterns that the human body can do. So things get shut off. These are called the multifidus muscles. And if you notice, they're right near the spine. And these do a really good job at stabilizing your spine segmentally. So actually what you saw in that video was me using that muscle group along with this transverse abdominis group right here. So this transverse abdominis, you can see, wraps all the way around. It's like your own little personal weight belt given to you by God. And it provides hoop tension. And if you're able to coordinate that really well, you can provide segmental stabilization. You can stabilize wherever you want, really. And then we've also got the diaphragm and the pelvic floor. So those are the muscle groups that I was enacting to stop that quake. And even bracing the outside of the core, bracing all those big muscle groups that we talked about that are usually strengthened in any sort of back pain rehabilitation program, it wasn't enough. So by knowing the anatomy of your core, by knowing how to build a core and strengthening it properly from the inside out, you can avoid back pain and surgery in the lion's share of cases in human bodies. If this is something that interests you and you want more, or you want to know how to condition those muscles, just leave a comment down below. If there's enough interest, I will do another video on how to condition those muscles.